Good afternoon, everyone. Thank you for joining us today. I'm Alicia Johnson, the Executive Director of Step Up Savannah, and we are so excited to have on the line with us today Ms. Alexander from the Georgia Department of Human Services. The Georgia Department of Human Services and Step Up Savannah have a long-standing relationship. In fact, we are contracted with the Department of Human Services as the gateway administrator for this area. And so as a part of our relationship with them, we help educate our community about the important role of public benefits in helping sustain the social safety net, as well as enrolling folks across Chatham County and in our contiguous counties into the public benefits program. So we're very excited about this opportunity to provide some education about the Department of Human Services and the wonderful programs that are extended to us in Chatham County. Next slide, please. Next slide, please. So Step Up Savannah is on every social media platform. You can connect with us on Facebook, on YouTube, or Instagram and Twitter. You can keep up with all of our programs, learn about new things coming to our community or things that we are providing to the community, such as this webinar opportunity today. And it helps get you connected to us and connected to our programming. So we're excited to be available to you. So one of the reasons Step Up Savannah is promoting our webinar series and providing education is because our mission is to ensure that Savannah is a community where all people have hope, and hope is a confident expectation of a favorable outcome and opportunity, where we challenge injustice and where all community members step up to reduce poverty. We at Step Up Savannah already understand that access doesn't always equal opportunity in the context of our community. And so what we try to do is help create that bridging capital across the social safety net that makes it easier for our community members to connect with local resources and to get the support they need to lead economically thriving lives. Some of Step Up Savannah's direct service programs include our AmeriCorps Vista program, where it's one of the only kind in this region, and we're very proud of our AmeriCorps Vista program, where volunteers, a skilled labor force from all over the country, apply to serve for free in a social service agency that focuses on poverty reduction. And so we are excited to report that we have a thriving AmeriCorps Vista program, and we are filling those slots every day. We also have a workforce development program. Our Chatham Apprentice program is focused on the unemployed and underemployed, and ensuring that those people who live across our county are stabilized in self-sufficient employment opportunities. That program happens regularly, where we provide full wraparound servicing to those individuals and help them earn stackable credentials and the skills they need to be successful in employment. We have a Bridges Out of Poverty program called Level Up, where we are focused on not only financial literacy, but asset building for the low wealth community and helping them expand their social capital. Our Neighborhood Leadership program, which will kick off on September the 13th, is an annual 12-week leadership development program where we help emerging leaders get the tools they need to learn how to advocate from self to system and to create innovative and capacity building programs in the community. We also have a public benefits program, and Kimberly Polk, our public benefits manager, is going to tell you a little bit more about that umbrella program. But we're excited about that program, where we have over 8 partners that participate in that program. And we also lead the Working Family Network, where like-minded agencies across the social safety net band together to close the gaps that we have in our community across the social safety net in order to support families in the LMI community. Kimberly, would you please tell them a little bit more about our public benefits program and partners?
Yes, absolutely. Thank you, Alicia. So Step Up Savannah, first of all, my name is Kimberly Polk, and I'm the Public Benefits Program Manager at Step Up Savannah, and I'm so happy to be here along with the DHS partners. Step Up Savannah has a public benefits program where we are the umbrella organization for 8 partners listed here on the screen, and we provide services to assist with all public benefits. So that's SNAP, Medicaid, tax, WIC, TNF, and we can help with applications, renewals, and case issues. We have direct partnership with the local Department of Family and Children's Services, where we can mitigate issues and help facilitate the application process. I'm now going to turn it over to Denise Alexander, our DHS partner, to go over the information we have for you today. Denise?
Thank you, Kimberly, and good morning, good afternoon, rather, to everyone. Special thanks, of course, to Kimberly for working with us to get this set up, and to your executive director, Alicia M. Johnson, for allowing us to present today. It is certainly always an honor for our team to talk about the work that our staff is doing in the Department of Human Services. And we really wish we could be there in person and we could talk to each other, but you know, with the pandemic, we have to be safe. So again, thank you all for this opportunity. Before I kind of talk about our programs and services, I always like to give a high-level overview of who we are as a department. So on behalf of our Commissioner, Gerald B. Hines, we appreciate this opportunity to let you know the work that we're doing. So we deliver a range of services, and it's all about promoting self-sufficiency, safety, and well-being for all Georgians. Our mission, of course, is to strengthen our state by providing individuals with services that promote, again, self-sufficiency, independence, as well as protecting Georgia's vulnerable children and adults. We do not believe that the state should be responsible for taking care of families. All of our supports are in place to get families in a place where they can be self-sufficient. Our vision in the Department of Human Services is stronger families for a stronger Georgia. We believe that if our families are strong, our state will be strong. So I'll be talking to you today about our program services, highlighting a few, and then ways that perhaps we can work together. We appreciate you for taking the time to join this webinar, and we want you to know that we recognize that we depend upon strong partners, of course, like Step Up Savannah, and we appreciate the work that you all are doing in local communities. Again, our DHS leadership is Commissioner Gerald B. Hines. This is the executive leadership. Demetrius Taylor, who's our Deputy Commissioner and Chief Financial Officer, Tangela Gray, Deputy Commissioner and Child Support Administrator, Abby Cox, Assistant Deputy Commissioner for Aging Services, John Hurst, Assistant Deputy Commissioner for Child Support Services, and Candace Gross, who's the Interim Director for the Division of Family and Children Services. So all of our services are provided under our 3 major divisions, which is Aging Services, Child Support Services, and Family and Children Services. These are the areas of our state, of our department, that connect with individuals across the state. DHS, we have a presence in all 159 of Georgia's counties, and we touch the lives of more than 2 million Georgians. Imagine that. So in our 3 divisions were, again, Aging Services led by Abby Cox, Child Support Services led by John Hurst, and Family and Children Services led by Interim Director Candace Gross. In these 3 divisions, with those 2 million people, to put that in context, is that we touch the lives of 1 in every 5 Georgians. And I'm going to be talking about each of the divisions, starting with Aging Services. So our Division of Aging Services is that division that supports older adults and individuals with disabilities, as well as their caregivers, through a variety of services, including things such as information and referral, options counseling, home delivered meals, legal assistance. This also is the area that does the investigations of allegations of abuse, neglect, and exploitation of elder persons and adults with disability. Did you all know that Georgia ranks 11th in the nation with the fastest growing aging population? With that being said, of course, our Division of Aging Services is challenged with meeting the needs of the rapidly expanding aging population in our state. We contract with the area agencies on aging across the state. Every area of the state has an area agency on aging assigned to it. And this is the office that provides the direct services. In your area, which is the coastal area, the area agency on aging is the coastal region, Region 12. It covers Chatham County, Bryan County, Bullock County, Camden, Effingham, Glenn County, Liberty, Long, and McIntosh. I hope you are aware of the area agency on aging. If you look at the map, it's in the lower right-hand corner. It is the Region 12. One of the things I want to make sure you get from this presentation is how to contact and how to find out more about information about any of these services that's provided. The number for that coastal, the coastal Georgia region, it's their local number is 912-437-0840. Again, 912-437-0840. There's also a toll-free number, 1-800-580-6860. So we use a lot of acronyms in the Department of Human Services. And when you see DAS, that's of course our Division of Aging Services. And here's a listing of some of the services and programs in that area. The Aging and Disability Resource Connection. No worries, I'm going to talk about that one later. Home and community-based services. You can get that information from your area agency on aging, which is coastal Georgia. Adult Protective Service, I'm going to talk about that. Public Guardianship Office, I'll let you know what that is. Kinship care, grandparents raising grandchildren. Georgia Cares Program, State Health Insurance Assistance Program. That's where we do the counseling around Medicare and helping you choose a plan when it's time to make those selections for those who are on Medicare. And then we have a senior employment program focusing on helping those 55 and older get back into the workforce. Long-term care ombudsman program and the elderly legal assistance program. As I mentioned, I was going to say more about that Georgia Aging and Disability Resource Connection. Wow, it is amazing. We have more than 26,000 resources statewide for people who call. So I would just encourage you. Some people say, well, how old do you have to be? Are there fees associated with it? The one thing that I would say, if you need any services relating to aging or adults with disabilities, call this number, 1-866-552-4464. Again, 1-866-552-4464. Some of the services are available, and this is just a smidgen of the services: home delivered meals, the congregate meals, caregiver support, homemaker services, respite care, and transportation. Again, these services are coordinated primarily by the area agency on aging. We call this number our no wrong door number, which means if you call that number, you get a counselor who will be able to assist you through determining the resources that may be needed. Our staff will not tell you this is what to do or tell you a selection. Basically, the role of our staff is to talk you through what kind of options you have available. And the counselors make decisions based on individual needs, and know that these are unbiased counselors. We're not selling anything. A lot of times you see advertisements of people selling things, but we're not selling anything. We're here to provide information so that people can make good, informed decisions. I want to just highlight dementia. So in case you are not aware, is that dementia is just an umbrella term that includes several diagnoses. And the one most commonly that we hear the most about, of course, is Alzheimer's. And if I was in the room with you, I would say, does it anyone in here know anyone with Alzheimer's? And I've not been in a setting yet where we didn't have at least at a minimum of one hand, but typically it's more than one hand. So basically, dementia is a growing concern for older adults, and that a concern that older adults are facing. Not everyone who gets older will get dementia. Let me clarify that. So Alzheimer's is the type of dementia that you hear most about, because 60 to 80% of the dementia diagnosis is Alzheimer's. So did you know that it's the 6th leading cause of death in the country, and it's very, very expensive to provide care for individuals with Alzheimer's. We have recognized what's going on with Alzheimer's. So we've put together some Dementia Friends awareness sessions. And the goal of those sessions are to help people understand key messages about dementia. One of which is not everyone will get aging. And one is to help people understand that it's a disease of the brain, and that it's not something that, people just get. It's something that happens to them just like other diseases that people might get. We're excited about being able to provide and share information about Alzheimer's and dementia. And we're happy to, of course, arrange a presentation with you on that topic. So by the year 2025, it's estimated that there will be 190,000 Georgians living with Alzheimer's. That's to be a 35.7% increase. So it's actually an area that we're really, really, really paying lots of attention to. One of the things that we have, which is really nice that you learn as a result of attending that session, is about the Georgia Memory Net. And that is something where we work with university to come up to improve the screening and care for dementia. There are facilities across the state that a primary care provider can connect you with, so that you can be referred to a memory access center with neurologists trained in dementia to either test or diagnose, to let you know if it's dementia or not. And then if a diagnosis is received, that they can get a customized care plan to help them in their community. It's an excellent resource. So I would just encourage you to, if you're interested in Dementia Friends, let me know. All right, I see I moved on my next slide. So another thing that I wanted to talk about, of course, was Georgia's Senior Hunger Initiative. So we recognize that there are seniors who go to bed hungry at night. There are seniors who have to make a decision about whether or not to buy medicine or eat. As a result, Georgia is, I believe, the only state that has a plan, or at least I know we're the first state to address senior hunger. And we encourage people, if that's a concern of yours, to get involved. We're talking about the health impact of senior hunger. Obviously, if you're not eating, it's going to impact your health. And we have people who are senior hunger coalitions that are working across the state. There's one in your region as well. The Area Agency on Aging can share with you information about that, or we can share information with you at that email address at seniorhunger@dhs.ga.gov. Adult Protective Services. So it's important to know with Adult Protective Services is that our area covers folks 65 and older or an adult with disability. And we do investigations of allegations. So until our staff will go in and do an assessment, we're not going to say this is physical abuse, this is mental, emotional, verbal abuse, sexual abuse. These are all the kinds of areas of abuse that we do investigations on. In addition to sexual neglect, it's neglect, self-neglect, or financial exploitation. We encourage you to just call that. It's that same 866 number, 552-4464, if you believe that someone is being abused or neglected and they're 65 and older or an adult with a disability. The other program that was on my listing was the Public Guardianship Office. And that's our staff who oversee vulnerable Georgians who the probate court has determined doesn't have anyone to look after them. So we have guardianship managers who act as surrogate decision makers and advocate for those folks that have been determined lacking sufficient capacity by the probate court. So here's some numbers to share with you. The primary number for our agent services at our office is 404-657-5258. But I would just encourage people to always call the 866 number. Know that that we continue to maintain and to provide services even with the pandemic. Our offices, physical location, you're not able to access those as a result of the pandemic. But if you call our staff, we are still providing the same services that we provided prior to the pandemic, because we recognize that the need for services did not go away as a result of the pandemic. So our focus is to ensure that Georgians are able to get the assistance they need from the Department of Human Services. The toll-free number again is at 866-552-4464. That's that ADRC number, our no wrong door number. And if you want agent and disability resource, know that if you're out of state or if someone is out of state and have a family member in Georgia, they can call that number as well. Sometimes people say, well, how old? I just encourage you to call that number. Allow the counselor to assist you. Adult Protective Services. Of course, everything starts with an automated system, but you can get to a person by following these prompts. Adult Protective Services, Georgia Cares, that's the Medicare counseling, long-term care ombudsman, and the senior hotline. We have tremendous websites to share with you for the area agencies on aging, our division of aging services, the ADRC connection number, Georgia Cares, state health insurance counseling program, a way also of reporting abuse, neglect, and exploitation, as well as the long-term care program. I'll move now to our division of child support services. I like to give the abbreviated version of this by saying that at the state, we believe that parents should take care of their children, whether or not they're in their household or not. We believe that children deserve being taken care of by both parents. So what we do is, if it's necessary, we locate parents, we establish paternity, we enforce orders, and we want children to, in addition to having the cash payment, that we want them to have health insurance. And when we say we want both parents to take care of the children, we have services and supports in place to help those parents who are not taking care of their children. We refer them to employment. We encourage them by supporting healthy co-parenting relationships and supporting responsible fatherhood. Now I'll show you information about our fatherhood program. Children need support from both parents. I think that presentation highlights kind of what I'm talking about. Our division of child support services recognize that there could be barriers that are keeping people from paying child support. So our fatherhood program, our fatherhood agents are in place. It's an employment-based program that focuses on services that help non-custodial parents achieve self-sufficiency and to be able to pay support for their children. This program provides GED classes, short-term training, resume writing, job placement, coaching, mentoring. And when you enroll in this program, you can get your driver's license reinstated when it's due to a suspension for non-payment. And there's also a federal bonding program. So if you have a criminal record, there's some assistance to employers to say, you know what, give this person a chance because they are federally bonded. In addition to the fatherhood program, we have another amazing program called the Parental Accountability Court program. So this program is where we work with Superior Court judges to offer an alternative to incarceration. Believe it or not, if a person is chronic, we have several enforcement tools that we can use, and one of which is incarceration. Well, obviously, if they're not paying child support, we don't want to put them in jail, because if they're in jail, they can't pay child support. So this is a great program where judges say, hey, listen, we don't want to put them in jail either, because we need our judges for, hardened criminals who are out causing violence to people and destroying property. So basically, this program is an alternative to incarceration, and it provides judicial oversight and helps parents overcome barriers to making their payment. The goal, of course, is to work with the parent who's not paying child support to remove whatever those barriers are, so that they can become a successful parent and a member of the community. I know the initial screen talked about the fatherhood program, but know that these programs that we're talking about in child support is for fathers as well as mothers. It doesn't matter which is the non-custodial parent, but the program is for both. We also want to make it easy for people to contact us, whether or not it is the employer who we need to work with to get a federal income withholding out of the employer's paycheck, or whether or not it's our customer. So for employers who are having to work with us around withholding, we have a hub of dedicated staff that works directly with them. And then these are staff where, the employer goes directly to someone. It's called a single point of contact to get access to information and agents to walk them through the process. And then on the other side of the screen, we have an app. Everything is in a mobile app now. We call it our DCSS on the go, so that people, when the offices were open, we're not having to come into the office to manage their workload, to manage their case, or to provide information. So that app has information that they can upload documents, they can request case history, they can find out any appointments they have, they can find out any letters they've been sent. So we think this is an excellent tool. It's available 24/7, and it decreases the need for people to have to take off work to go to our local offices. And then our third division I'll be talking about is our Division of Family and Children Services. And you may have heard or may have seen them in the news, because this is the office that does the investigations of reports of child abuse. We also find foster and adoptive homes for abused and neglected children. We're the office that does the eligibility for SNAP. And you'll see that that's what was called our food stamp program, Medicaid, temporary assistance for needy families to low-income households. And again, we determine the eligibility for those programs. We also, the Division of Family and Children Services also helps out-of-work parents get back on their feet. Again, our services are designed to promote self-sufficiency and independence for all of our Georgians. And then we provide numerous supports and innovative programs to help families in need. So the mission of the Division of Family and Children Services, which is in, of course, the Department of Human Services, is to be the provider of choice for services that promote, again, well-being of children and families, economic self-sufficiency. You'll hear that a lot as we talk about our services and programs, and that our community is able to provide opportunities and support to their members. And when we talk about DFACS, or Division of Family and Children Services, we talk about it in terms of two bodies of work: child welfare and the Office of Family Independence. And I'll speak briefly about each of those. So in child welfare, that's where we have foster care and adoption, after school services, where DHS funds summer and after school programs, which include academic achievement activities, health education, physical activity, and teen employment opportunities. This is, of course, the child welfare is where we do the investigations of child abuse and neglect. We also have the Office of Prevention and Family Support. Know that our desire is that if a child has to come into care, is to bring that family back together. So if there are some services and supports that we can provide to them, this is the office that works with the family, because our ultimate goal is to ensure the child is safe, and where it's possible, we do want that child to return to their home. And then finally, the Georgia Crew program, which was formerly Teamwork. And this is the program that works with our youth 16 to 21, so that our youth in foster care, to give them skills so that as they transition out of foster care, that they can become a productive member of society. So children in foster care, again, DFACS is responsible for ensuring that children are safe from abuse and neglect. And when DFACS determines it is not safe for a child to remain in their home of his or her caregiver, then that child is placed in foster care. Just to give you some numbers, I know some people like numbers. I'm not a number person, but I do know people like numbers. So the average number of children in foster care each month is around 12,000. And I know that you guys are based in Chatham County, Savannah area. So I just thought for conversation today to let you know that this was a point in time number. The number fluctuates, but when we pulled this report, there were 435 children in Chatham County in foster care. And in parentheses, you'll see 176 or 40% of these children were placed inside of Chatham County. So where do you think the other 60% were placed? Obviously outside of Chatham County. And I'm sharing this information because we have a tremendous need to identify additional foster parents. And if you have, I like to say, love in your heart and especially space in your home, we just encourage you to consider being a foster parent. We realize too that not everyone can be a foster parent. And if you can't, then there are other ways that you can support this program. Adoption services, when it gets to the point where we have to sort of terminate rights and move a child into adoption, we do that. But for Georgia's foster care system, adoption presents the opportunity for a child to have a lasting family bond. People oftentimes ask, what do you have to do to be able to adopt? And I just wanted to share this information. You have to be at least 25 years of age if single, and 10 years older than the child or the children to be placed. Married and living with a spouse, and 10 years older than the child or children to be placed, and a resident of Georgia for at least 6 months prior to the adoption. We encourage you to call. This is the intake number here, 1-877-210-KIDS, KIDS, 5437, if anyone might be interested in adoption. Child Protective Services, I briefly spoke about that, and that's the staff that does the investigations of allegations of abuse, neglect, and exploitation of children. Aging Services does the investigation for adults, and DFACS does the investigation of children. And how to report it, of course, dial 911, call your local police department, or you can also call DFACS Child Protective Services at 1-855-GEORGIA-CHILD, and that number is 1-855-422-4453. So the Office of Family Independence. The Office of Family Independence provides these services: temporary assistance for needy families, Medicaid, that's family Medicaid, aged, blind, and disabled Medicaid. And we wanted to especially note that Georgia is not a Medicaid expanded state, which means that in Georgia, in order to get Medicaid, you have to be family Medicaid with a child or aged, blind, and disabled. Under OFI, you also have the Supplementary Nutrition Assistance Program, which is the SNAP program, Low Income Home Energy Assistance Program, LIHEAP. And then to apply for these services, it's great. It's the Georgia Gateway, which is an excellent one place to apply for all of the services. And the online application is at www.gateway.ga.gov. And of course, you can always get a paper application by going online or calling at the bottom, the 877-423-4746 number. So the OFI programs, Temporary Assistance for Needy Families, what is that? It provides a one-time cash assistance to Georgia's neediest families. And right now, the average caseload number of cases is about 12,600. And of those 12,000, over half, as you can see, are cases with children only. The Supplementary Nutrition Assistance Program, SNAP, it's a federally funded program that provides monthly benefits to low-income households to help pay the cost of food. The average monthly number of SNAP recipients in Georgia was around 1,396,000. We also have, as we talked early on about our department focus on self-sufficiency is that we have a SNAPS work program, and it's designed for those that are 18 to 49 to help them. If you're receiving SNAP, it helps them gain skills, training, and experience to reduce their reliance on SNAP. And when the report was pulled for the DHS fiscal year 20 annual report, there were 118,054 SNAP recipients. So I'm going to wrap up and just talk a little bit about volunteer opportunities. We appreciate, of course, Step Up Savannah and the great work that Ms. Alicia Johnson and her team is doing, but we always need additional people to help us. We recognize we're a state agency. We can't do all of this work by ourselves, so we need your support. If anyone out there is interested in providing any mentorship, training, or summer opportunities for our youth in foster care, again, these are the kids that we brought in care, and we want to make sure that they're able to transition out of foster care, that they can get some skills at that time. Volunteers to support foster parents. Oftentimes you might say, well, what does that look like? We just encourage you to call your local DFACS office and talk about what their needs might be. If you're an employer, provide training and employment opportunities for adults, our senior employment program for the seniors, as well as our youth programs, workforce opportunity tax credit. Use that to hire one of our designated individuals. People in our programs are considered designated individuals. We do have drives from time to time. In December, we have a Secret Santa for our kids in foster care. We have a holiday drive for our kids in Adult Protective Services in the Public Guardianship Office. Any of those programs that there can be assistance to. And then a corporate match for our State of Hope seed funding. That's a program in DFACS where they provide funding for grants. They go through a process, a cycle each year to determine innovative projects to fund. And of course, we're always looking for support to those. And then we have a volunteer services opportunities guide that you can find on our website, which is DHS Georgia spelled out georgia.gov/volunteer-service opportunities guide. And then are there any questions? I'm not sure, Kimberly, how you want to do questions, how we want to do that. And as they're coming, I will also put my contact information up on the screen if you want to reach out to me. Know that we are committed to ensuring that people receive this kind of information regardless of the pandemic. I operate at the enterprise level, so if there's information about any of the services or programs that I've talked about, you want more information about, I can connect you with our staff to give you the details. And I can answer general questions. You can email me directly. I have my email address on the screen, as well as our outreach mailbox. You can email that as well. So Kimberly, do we have any questions, and how do we want to move forward?
Yeah, absolutely. Thank you for the great presentation, Denise. Right now, we don't have any questions in the chat unless they have commented privately. Mary, have you seen any questions?
I haven't seen any come through the social media comments, and I haven't seen any come through the chat so far. If we want to give a minute to kind of see if any come through, I'm going to go ahead and put your email in the comments as well, just so that people can reach out if they do have any questions as well that they want to email you personally about. So I'm going to go ahead and do that.
We do have one question that just came in, and it says, what is the process for serving notice to parents when a child support application is filed?
So what I would ask that you do is to, reach out directly to our child support staff. Again, I'm not a subject matter expert, but if you give me your email address, or Kimberly, I don't know how we can do that, but I can have someone from our child support team to reach out directly and provide that information. And I'm glad you raised that question, because one of the things that oftentimes I get in these presentations is regarding child support is that, people's driver's license are being suspended and they didn't know. And what I like to share is, as a result of doing these presentations, is that Number one is if you have a child support order, it's important that you keep us your current address. If you're moving around because you would have received notice, and there's a lengthy process. I think it's almost 6 months before the license is actually suspended. So are we seeing this person's email address where I can follow up with them directly?
Yes. So Kyle, if you could drop your email address in the chat, we can certainly get that over to Denise and follow up with you directly. Thank you.
Or my email address is on the screen and you can email me directly, because the
Yeah,
one
that's
thing,
another.
yeah,
Go ahead, sorry.
it's I tell you that I talk about at the enterprise level, but specific information around cases. And sometimes it's helpful to talk to the staff folks because, for these kinds of presentations, obviously we want to protect people's confidentiality. They are able to actually pull up the case to tell you what's going on and give you more information than in more of a broad setting like this. So I would just definitely encourage you to reach out to me and allow me to connect you with the staff for that area.
And we did have another question that came through as well. Jessica asked, there was a program for seniors with dementia, you mentioned, where they could be linked with an MD in medical care. They just asked what the name of that program was.
So when a person goes to see their primary care provider in Georgia, you can ask them to do the assessment, and it's called the Georgia Memory Net. And primary care provider must refer you to that program. It's called the Georgia Memory Net, and your primary care doctor must refer you to it. There are 5 locations around the state. The goal ultimately is to have them all within, I think, like a 90-mile radius of all people in the state. But that's what it is. It's to connect with the Georgia Memory Net. Does that answer the question, you think?
Mm-hmm.
Thank you. We're real excited about what we're doing with dementia. I've actually been trained to be a dementia champion, and we're looking for people also to become dementia champions. And, the messages that we like to get to people is that you can have a productive life with dementia, that you can, that it is a disease of the brain. We have wonderful testimonials where people are actually living with dementia and sharing that. We don't call it, suffering with dementia. We want people to recognize dementia as a condition as you would cancer, diabetes, hypertension, and to be able to deal with it in the same way. We're really excited about that program, and we're looking for people to be trained to become, dementia champions and to offer, the presentations across the state.
Yeah, that's perfect. Thank you for answering that. I don't think we've had any other questions come through. I haven't seen any other in our chat or on social media. I think that might have been the last question. I've put your email in there as well. Like you said, if there are some more specific questions and for confidentiality purposes, that's great that they have that they're able to reach out to you. So we really appreciate you for that.
And know that, again, I spoke about all 3 of our divisions, which is aging services, child support services, and family and children services. So if you're affiliated with a group or organization that works with any of those customer populations, particularly aging services or adults or family and children, we're happy to arrange a presentation to have a really deep dive into any of those conversations. With the presentation like today, my goal is to give you just a high-level overview, touch, all of the areas are important, but, in the time given, I certainly want to respect people's time. I don't want to get, into those too much, but I did want to share, I did find some information. Let's see, where did I put my little note? There was a question, or someone may have wanted to know the difference between Medicare and Medicaid. We have staff, wonderful staff, do outstanding presentations on those programs. But I did pull one of my little handouts, and it said, of course, Medicare, that's the care, C-A-R-E. It's a national program, and it's the same across the country. And it's for people 65 and older, or if with certain disabilities. Okay, so that's two important things to know. Medicare is a national program that is the same across the country. It's administered by the federal government, and it's a health insurance for people 65 or older or with certain disabilities. Whereas Medicaid is a statewide program, and it's different between states. So if someone lives in Georgia, their Medicaid program may look one way. I'm from Virginia. My Medicaid program in Virginia may look different. And it is administered by state governments, but within some parameters with federal government rules. And it's for health coverage for people who meet financial and non-financial requirements. So Medicare, again, is for people 65 and older. If they've paid in, they get it. But Medicaid is for people who meet certain financial requirements. And as I shared going through the presentation, you know, some states have expanded Medicaid to who can get it, but Georgia has not at this time. And so right now, the only folks who can get it is the aged, blind, and disabled, or people with family Medicaid. So there's a group of people who between maybe 18 and 64 who are not eligible in Georgia, but may be eligible in some other states. And I just wanted to highlight that Medicaid looks different in different states, because people move here and expect to have the same thing they've had somewhere else. And for some programs and services, they can, but for Medicaid, of course, it's different. And of course, Medicaid is the nation's primary public payer of also mental health and long-term care services. So that's about all I can share on those two. Anything more than that, I would have to bring the experts in to have them talk to you, because I definitely would not want to give you any information that I'm not 100% sure of. I hope that was helpful.
Yes, ma'am. Thank you so much. Mary, do we have any questions on social media?
I haven't had anything else come through either in the chat or social media. I think that was some great information. So we really appreciate that.
Yeah, absolutely.
Okay, so let me add one other tidbit about, okay, so I talked about that. That's really under the DFACS umbrella. Let me just share two for our division of child support services. So just know that all of those services are free, and we have relationships with technical colleges. So if people want to get a skill set like welding, we pay for people to go to truck driver school. If people want some support and services, our fatherhood agents and our parental accountability coordinators, they are here to help you. There was one, and I didn't realize if I, okay, there's another little video that I could have showed y'all where a person was actually saying, hey, you know, I wish I had known this a long time ago. I wouldn't have gotten so far behind, because people were actually avoiding our staff. And we would just encourage you that if you are struggling with child support, regardless of why, please don't avoid our staff. Reach out to them, because our first thing is not to take your driver's license or put you in jail. Our concern is for you to have the resources and supports so that you can pay your child support. So we just encourage you to reach out to us and to allow us to help you.
Yes, absolutely. Thanks so much for this information, Denise. If we don't have any more questions, we'll go ahead and close this out. We thank everyone who was able to join us. This presentation will be on both our Facebook page as well as our Step Up YouTube channel. So if you want to go back and look at the information or share it with others, feel free to do so. Again, thank you, Denise, and we will close our time together.
Thank you.